Broadcasting from Manhattan Beach and the World Wide Web, you're listening to CHSR, HealthyLife.net.
As a service to our listeners, this program is for general information and entertainment purposes only. CHSR, HealthyLife.net does not recommend, endorse, or object to the views, products, or topics expressed or discussed by show hosts or their guests. We suggest you always consult with your own personal, medical, financial, or legal advisor.
Hey there, and welcome back to the Dr. Theresa NIcassio Show. This is a place of inspiration, education, and hope for a healthier, more compassionate, and sustainable world. For those of you who are new to the program, I'm an integrative psychologist and wellness educator of over 30 years and am committed to empowerment and inclusivity in all its forms. I not only feel that it's important to talk about the issues that matter most without dumbing down the information, but also to talk about issues that are often shrouded in shame or are maybe less comfortable to discuss, kind of like today's show. In this forum, I invite change makers, international leaders in the field of health and the environment, as well as inspirational everyday heroes to share their knowledge, experiences, and wisdom with you. My purpose for doing this is to help you in your efforts to change your own life better equipped with the most up-to-date information available. Information is power. I love to say that, as well as is community. And I'd like to thank you all for being a part of this effort as we together harness the globally growing vision for change to help make the world a better place for everyone. To make a donation to support the continuance of this program, or if you have products or services you would like to share with my wonderful audience as a sponsor or advertiser, please go to the TheresaNIcassio.com website and click on the donate button at the bottom of the page. With well over 1 million monthly listeners to the network, syndicated and simulcast around the world, reaching over 130 countries and over 63,000 monthly listeners to just my show alone, it's a wonderful vehicle to spread the word about your business. You can also email me directly at Theresa@TheresaNIcassio.com or contact me through my website. And again, my name is Theresa with an H. NIcassio is with an N like Nancy, and it has one C and two S's, so it's TheresaNIcassio, so TheresaNIcassio.com. Be sure to tune in next week when inspirational speaker, TV host, and author Yvonne Heath will be joining us. Yvonne's going to be talking about living life to the fullest and how truly showing up, she's got this Just Show Up campaign, which is awesome, but just how truly showing up for yourself and others can bring more grace to the journey of facing grief when death arrives. So she's calling the show, I think it's something like Live Your Life to Death. It's pretty, it's going to be a really powerful program. But get comfortable. For today's show, I'd like you to welcome with me Dr. Barb Depree, who's going to be talking about sexuality for life with us. So she's a gynecologist, Dr. Depree, and she's an award-winning menopause specialist who's been a women's health provider for almost 30 years. As the author of Yes, You Can, Dr. Barb's Recipe for Lifelong Intimacy, and the founder of Middlesex MD, Barb's pioneering work as an educator is a source of hope for women and their partners as it redefines how we think about sexuality into our middle years and beyond. Thank you so much for joining us today, Barb. It's really wonderful to have you here on the show.
Thanks for having me, Theresa. I'm eager to speak with you and your audience.
Yes, this is it's really important. I think that, when I look for guests, I look for people who are finding, kind of sniffing their way into the unspoken zones, and I really appreciated what how you shared the evolution and how you ended up writing your book and starting Middlesex MD. I wonder if we could start with sharing a little bit with our listeners about how you became so passionate about menopause and especially about sexual intimacy and women's sexuality and sexual health into our later years.
Well, having a career in women's health, it brings you into their lives in really unique and fascinating times. And in the past, I did obstetrics and was involved in that aspect of women's lives. But as I moved away from that, I found myself having conversations with women about not only their general health, but oftentimes about their sexual health. And I started implementing a survey in my practice. Really, it was an introductory kind of get acquainted, ask a number of questions to try to help identify where women, desired increased information or assistance. And it didn't take long before I was really astounded by the number of women who expressed dissatisfaction, discomfort, or some area in their life relating to sexual health that was very disruptive or negative to them. Mm-hmm. So it became my focus to be a bit more intentional than about making sure I was incorporating that into my more routine practice of gynecology. And again, wow, it was somewhat overwhelming at the number of women who would share their difficulties and then their journey of how they didn't know where to go with these questions and how most healthcare providers didn't have time or knowledge to help guide them. So I really, many years ago, became to have a somewhat more focused practice in sexual health, and probably more specifically to the perimenopause and menopausal woman, just because the physiology of what happens with that poses unique sexual challenges for women.
Mm-hmm. Yeah. Well, and one of the things early on in your book you talk about sex education in schools. I love that little piece. The awkward movie time with the gym teacher, whoever is teaching it, and it's a really good point that I hadn't really thought about before reading your book and reading about your materials. And that is how sex education kind of takes you in and through puberty and then through how babies are made and born. And then it just it's also like a cliff that drops off. It's almost like nothing else happens, or you just don't know what happens into that wild yonder. And,
yes. And I would say a bit, unfortunately, we kind of leave it up to culture to train us on that, which is culture and media, which certainly has some value, and I don't want to discount, but unfortunately it's such a skewed view of what I would see as healthy sexuality that there is a lot of gap in there between real honest and true knowledge and more unrealistic media expectations.
Mm-hmm. Yeah. And it's even, the experience of being a sexual being, or the perception of being a sexual being into the later years is really not, in the media, as you're mentioning, it's really not very positively portrayed.
It is not. And, we really want to try to help promote a conversation and use the term sexual health, because the word sex and, sexuality, there are so many responses and feelings that go along with that. But I think it's important for women to really, and men for that matter, obviously my view of the world is really women's health related, so I don't want to say this is isolated to women. It's certainly not. But we want women to recognize that this is a really important aspect of their whole life. We talk a lot about physical health, and in the healthcare industry, we obviously focus on physical health, but we don't spend as much time on sexual health and, as you would know, emotional health and spiritual health. And I think when you bring it up to individuals about this idea of sexuality and a core component of who you are and what it takes to actually nurture that and promote that, most people have left that to neglect and happen chance and just haven't really thought about being intentional around it. So I think it's helpful to just add awareness and intentionality around this aspect of women's health and then relationships usually that are impacted by that.
Absolutely. And I think I want to really bring to the fore that this is This is about the experience of being sexual beings and caring for our sexual health. And that really is, as you're saying, whether we're women or men, your expertise is going to be women's health, and we're going to be talking more about some of those specifics. But we're also, it doesn't matter whether you're single, whether you're partnered, whether you're in a relationship with someone of your same sex, opposite sex, it doesn't matter, but it's about that, I think of sexuality, I go back to Kundalini sort of spirit. Sexuality is really sort of a life force energy that's within us, and it has a creativity and expression and expressiveness, and it also has its a physical manifested form that is expressed through, as you're mentioning, sex or sexuality, which can take many forms.
And I would imagine in doing what you do, you have the opportunity to better understand individuals and their relationships through their sexuality and sexual health as well.
Absolutely. And the meaning that gets meaning and self-perceptions that get intermixed, interwoven into it, and sometimes less than healthy ways, and so finding that liberation is part. I was so excited to discover you, or to have your I was contacted, and I discovered you through that medium. I really appreciate what you're doing. So let's just go back a couple steps then. We talk about how in the sexual health conversation in the gym in grade school that they kind of drop off, and they don't really get into the perimenopause and menopause. Can you give us a little bit of a overview of some of, you talk about some of the physiological changes, and maybe you could talk about the overview of the changes, the physiologic hormones, neurological and so forth that you'd like to highlight.
Yes, I think it's somewhat fascinating that menopause is somewhat of a unique human experience in that we have organ failure. Really, ovarian failure is menopause, where there's no further production of estrogen or progesterone. And it's really the only condition that we expect that to occur, and we really, generally speaking, don't do any intervention necessarily. We see it as natural and normal, of course, but the actuality of what do we do about it is more or less expected that there won't be any treatment for it, where if we'd have any other endocrine gland failing to produce the hormones it normally produced, we'd be right away talking about how we're going to supplement your thyroid or your insulin, for example. So it is kind of a unique condition in that way. But I think, the understanding of the impact of 40 years of having ovaries function and day out, making primarily estrogen and progesterone, and then what the consequences of the absence of those hormones mean. And I explain it to women that you have estrogen receptors everywhere in your body. Every tissue has an estrogen receptor, and therefore an activity that estrogen promotes or produces. And so now in menopause, it's not surprising that without circulating estrogen, many areas may be impacted by that. Your brain, your skin, your bones, your vagina, your breasts. But the area of impact and the most concentrated area of estrogen receptors really are your genitals. So the impact over time of menopause and the absence of those hormones makes the vulva, vagina, bladder, all of that function quite differently, and unfortunately not better, but for most women worse over time. So just helping women anticipate that and understand that, and then in turn provide them with the knowledge of options to address those changes as they may come up. And for some women, they may never be bothersome to them, and for other women it may be greatly impacted within 3 to 6 months of their last period, or maybe even still in perimenopause. So every woman does this journey quite uniquely, but trying to understand how each individual is impacted. And then sometimes it's just the knowledge that helps them navigate it successfully, but other times there are treatment options we can introduce. But certainly over time, sexual implications almost always become somewhat of a factor.
Yeah. Well, and I find that it's interesting that it's not uncommon in those during that period, getting into the 50s, and in particular getting like in the 50s, and that there's more, and I see with couples, there can be more challenges in the relationship, and sometimes there's a greater risk of infidelity because of the frustration and the lack of understanding and of the process. Or one of the things that you and I were talking about just before we started today, and I think we spoke about when we were on the phone quite a while ago, was about how women just kind of go underground and just like, oh, well, this is, I guess that part of my life is over. And I think that as you're saying, the knowledge is really important, and if you are in a relationship with another person, having an appreciation and patience and a willingness to address the issues if it's possible to do so.
And I think, probably my primary motivation for focusing on that is exactly what you've just stated. I will say to women, I understand you're in a loving relationship and an emotionally supportive partner, and sex isn't the end-all, be-all. It is not the ultimate outcome of every relationship, but it is really important in ways you probably can't completely understand. Mm-hmm. And especially if your partner is a male, we often see a desire discrepancy where women lose desire years often in advance of men. And then if you add the changes that go on with menopause, being maybe dryness or discomfort or taking longer to arouse an orgasm, and you over time opt out of being sexual, this discrepancy becomes a bigger issue in the relationship. And granted, I don't ever want to make assumptions of what your partner's going to do in the face of that, but your reference to infidelity, I absolutely have seen many relationships not survive this transition, and I think it's deserving of comment and awareness that it needs to be tended to. And even though it may not be the absolute responsive sexual desire that it once was, it doesn't mean that it can't be present with more mindfulness and intention, and that it can continue to flourish. But it takes more effort, and once upon a time it took very little effort.
Right, and when the hormones are really higher, then that's one thing that it has then it's easier. But and you make a point of that. I forget exactly how you say it in the book, but how because we're not as motivated as we get older to be as sexual, that sometimes it's a choice, and then once you make the choice, then it's usually a positive experience after for you, but that it's not one of those things that you are just feeling like, oh, I really want to do this in a way that you might when you were in your 20s.
I will often describe it to women that women are in their 50s or beyond more responsive rather than spontaneous. So it's not that you're not willing to respond to a sexual cue. You're just less likely to initiate. And so that communication to a partner about that, I think, is important too, because women will say, oh, he thinks I don't find him attractive, or he thinks I'm seeking pleasure somewhere else. And we'll say, it's not that at all. Well, I think it's important to communicate that to your partner so they have an understanding of where you're coming from as well.
And it's actually not a bad time to consider getting couples counseling, even if you're doing fantastic in the relationship, but just have another third party, of someone who is aware of sexual health and the importance of that, when you're in that transition period, and to talk about catch it nip in the bud before it becomes a challenge, and to find new ways to navigate the relationship and other ways to enhance the sensuality in the relationship and keep that special spark alive.
I think it is an area that is often a bit repetitious, and so for many couples they've figured out a routine that has worked. But again, as things change, and maybe you need to use a lubricant, maybe you need to introduce a vibrator, sometimes it's hard to recreate a conversation around that and know how to change it and move forward and kind of get out of maybe the rut of the activity that it once had been, and that's no longer working for you. So you need to discover the language to move forward.
Absolutely.
And that's where therapists can be very helpful in giving a third-party voice to that.
And to normalize it, right? It doesn't have to be like a big mystery. It's just we go through different chapters in our lives, and this is one more new chapter to explore.
Yes, it is. It is a reality of the changes that happen, like other changes when you introduce a new baby into your household, right? Everything's different. This is another new chapter, but it's probably worth investing in to optimize what that's going to look like moving forward.
Exactly. Great. Okay, folks, so we need to take a break. Don't go away. We're going to have a lot more with Dr. Barb and around lifetime sexuality and sexual health when we come back. Don't go away.
Being inspired by a speaker while learning everyday positive information that you can use to help your life is exactly what Dr. Theresa NIcassio does when she speaks in front of your group. From healthcare professionals to special needs parenting and everything in between, Dr. Theresa NIcassio can customize topics for your group on everything from health to psychology. To book Dr. Theresa NIcassio as a speaker for your group, visit yumfoodforliving.com or call 604-445-6463. That's 604-445-6463.
For all your live or pre-recorded webcasting needs, come to earthchannel.com. Get your web-based message out to a select group or the whole world. It's easy. A pioneer in webcasting, earthchannel.com provides the best products and services to big corporations and government users. And now this same technology is available to you. They have the best Earthcast encoders, servers, and products to meet your technical needs. But wait, don't want to mess with technical stress? No problem. They'll do it for you. EarthChannel.com is your answer. You can use webcasting for lots of things like advertising, marketing, customer support, training, and don't forget web radio and TV. In fact, you're listening to a live Earthcast right now. So come to EarthChannel.com. Actualize your audio or video webcasting needs today. You can't beat the friendly service or the price. Call earthchannel.com at 1-800-849-8978. That's 1-800-849-8978.
Yumfoodforliving.com is the place to get easy allergy-free recipes, all free of sugar, gluten, and dairy. But that's not all you'll get when you visit yumfoodforliving.com. You'll get resources for all kinds of things like wellness articles, videos, podcasts, a blog, all to help you create easy, healthy living. There's even a 50-page downloadable book introducing you to the philosophy of yum. Don't wait. Visit yumfoodforliving.com. Yumfoodforliving.com. That's yumfoodforliving.com.
If you like to spend your television viewing time learning about some of the things that you may have missed in history class, or if history was your favorite subject, then you should check out the link to the History Channel on the HealthyLife.net advertiser page. Order DVD sets by series or by subject matter right from our homepage while you still enjoy your favorite HealthyLife.net show.
You're listening to HealthyLife.net, the radio network that brings positive talk with positive change to make your world a little better.
Welcome back to the Dr. Theresa NIcassio Show. For those of you who are just joining us, on today's show we're talking with gynecologist and menopause specialist Dr. Barb Depree about lifelong intimacy. And one of the things that you just mentioned in last segment, Barb, was about how there's, with the organ failure, it's really an interesting perspective on it. Organ failure, ovarian failure, which is an inherent part of what menopause is. And the subsequent reduction in estrogen and progesterone and so forth. You alluded to some of the other implications and impacts of that, and I wonder if you could talk a little bit more about that. In particular, I'm interested in and the emotional, psychological and emotional impacts that people may not be aware are a reason. There's a reason why there's these impacts.
There is a physiologic reason why, and I think sometimes women are just reassured to know that because, it can come out of left field and be very disruptive in so many ways, and to understand there actually is some expectation around that. So the way I describe it to patients is that the biggest target organ for hormones is really your brain. Mm-hmm. And the result of disrupted hormone production in perimenopause, and then the absence of the hormone production in menopause is sort of a, back-to-back insult, so to speak. And some women just are much more prone to that than others, and we don't know why. But we do understand that estrogen, for instance, seems to really promote neurotransmitter function, and so this, the benefits of what it means to have functioning serotonin and norepinephrine and dopamine. And then what happens when hormones are not being produced at those same levels, the consequence to that is seen cognitively. Women talk about brain fog and focus and concentration. They definitely see a disruption, and that can translate to feeling less secure in your job and your work and what you do. And I often hear women talk about giving up some of their projects or presentations at work because they feel a little less confident in their skills. But also largely mood. It's a big impact for mood for many women. I tell women if you have a history of PMS, postpartum depression, or some hormonal changes that you're familiar with cause some emotional disruption, certainly menopause is an at-risk time for that. Even women who've never been familiar with hormonal fluctuations and mood changes are still at risk. And I probably hear anxiety as the most disturbing mood change that goes along with perimenopause and menopause. And, of course, that then can impact how you interact with other people around you, primarily home, maybe at work, how you communicate. Many people begin to withdraw. They're not that comfortable being around crowds or other people. So it's pretty interesting how women change how they function in the world as a result of menopause. Again, some women will make this transition effortlessly, seamlessly, with seemingly no changes, but most women find there is some disruption to how they have felt and functioned. The fortunate thing is over time, the adaptation to that new normal, so to speak, is usually favorable, but for some women it can take many years. And unfortunately, because our families, primarily our primary partner or spouse, is often the recipient of the difficulty, and that's another time relationships can really suffer going through this stage.
Mm-hmm. So it's not even just the physical, whether someone even wants to have or does have sex, or there's issues with that, which associated with the changes in the vulva, the genitals, and so forth. But there's the you become a cranky pants. It's a little less fun to be hanging out with you, and
absolutely.
And then later on, it's the sleep disruptions that oftentimes go with the perimenopause and menopause, and oftentimes even increases in pain, like joint pain and so forth, because of the reduced estrogen. Is no longer as high or there to mediate. We don't have it there to mediate the some of the joints and so forth.
Yes, absolutely. It's fascinating to think about. Again, the wide-ranging impact of hormones, and then this transition to absence of them. So, again, the reassuring thing to women is you're not alone in this, and it's not some other crazy thing likely going on, but it doesn't necessarily make it any easier to navigate, and that's where talking to a provider about the symptoms you're experiencing and what might be going on. But obviously, meanwhile, women are often dealing with aging adults and teenagers and young adult kids and maybe career crises. So menopause never happens in isolation, it seems. It's always in the context of other often challenging things.
Yeah, very complex. And one other challenging thing is as we get older, sometimes there's different health challenges that emerge, and even sometimes medications that people can be on, either themselves or even in their partner. But, can you talk a little bit about some of the meds that can impair libido and kind of sexual interest and sexual performance?
Yeah, that's a really good point, because obviously over time multiple conditions occur, both, as you mentioned, both for a patient and her partner, that can certainly interfere in function and desire. And probably really the biggest one that comes up in that regard is going to be the antidepressants. Mm-hmm. By and large, the majority of antidepressants work to influence serotonin and or norepinephrine. And while we feel better in the presence of more availability of serotonin, at least regarding depression and anxiety, it's really a negative for women sexually. So it's also important, I think, for providers who are prescribing that class of medications to talk to their patients about the consequences that might occur with using a medication, because patients need to make the decision about, is this worth the benefit I might be getting from a medication. And specifically, that class of medications can make it very difficult to orgasm. I had a patient last week who reported that, and she said, I was numb. My brain was numb, but my genitals were numb. Nothing worked. No vibrator was going to work. Nothing was going to touch it. For her, it just wasn't even close to being a reasonable option to give up that much sexual enjoyment for the medication she was trialing. And then there can be blood pressure medications, cardiovascular medications. Pain medications are also a big class that can interfere and, again, negatively impact women sexually, both for desire and function and ability to arouse an orgasm. So if you're experiencing some changes there, it is helpful to go back to your provider and ask the questions about, is my medication list, could that be contributing to some of the difficulties you're having sexually?
Mm-hmm, for sure. And so there's all these challenges, and as we're going to be moving into the next the next half of the show, we're going to move more into intimacy, erosion of intimacy, and solutions. And but I'd like just before we do that, I was wondering if you could just mention briefly about your website, because of the blogs. Because it's a really important resource, and I want people to know about it. And again, you can learn more about Dr. Barb Depree on my website, the TheresaNIcassio.com website, and you just click on radio shows, or click right on Barb's face on the front page right now. But you just can click on that and get to a page which describes a little bit more about her and has resources to access her website, her social media, and so forth, and some of her YouTube videos. But if you could just real quickly just say what this website is, Barb, and maybe the website. You can name it, even though if you forget it, it's on the Theresa NIcassio.
Sure. The website is called Middlesex MD, and it really came out of a desire to educate women about sexual health. So I break it up into 5 categories called knowledge, again, reviewing some of the physiology, comfort, reviewing sexual comfort, vaginal dryness, sensation, ability to arouse an orgasm, pelvic floor tone, the importance of maintaining strong pelvic floor muscles, and then intimacy, the more soft touch communication side of it. And then I provide products available to women, because oftentimes there are solutions to painful intercourse. It may be selecting the right vaginal moisturizer or lubricant. So I also talk through how to make a selection and maybe look at treatment options, ways to solve this, why it's important to incorporate a vibrator, and how you might do that with your partner if you've never done that before. So it's really trying to promote the conversation around the issues and then solutions.
Fantastic. So we're going to, again, slip off to another break, and we're going to be talking next about intimacy, foundational intimacy, and erosion of intimacy. We've touched upon a bit, but we'll be going there right after the break.
There's a book that makes it so easy to embrace a healthy, gluten-free lifestyle, even kids will like it. Filled with heartwarming stories, food as medicine health tips, easy allergy-free recipes, and creative culinary inventions, the award-winning book Yum by Dr. Theresa NIcassio is your source for all of this and more. So make gluten-free living easy, tasty, and fun. Get Yum, plant-based recipes for a gluten-free diet at Amazon.com or visit yumfoodforliving.com. That's yumfoodforliving.com.
What does HealthyLife.net and Amazon.com have in common? Well, they're both available on the Internet. They both give great value. But most important, most of our positive program hosts and guests are accomplished authors, and their books are available from, you got it, Amazon.com. Now, it even gets better than that, because when you're listening on air to a HealthyLife.net host or guest, you can go directly to Amazon.com and you can order your book while you're still listening to your favorite HealthyLife.net program. So when you hear an author you like, go to the homepage of HealthyLife.net and click on Amazon.com.
When you have a food allergy or dietary limitation, Dr. Theresa NIcassio knows it's hard to give up the foods you love, so she decided to put on her chef hat and give you affordable, personalized culinary consultations that will light up your taste buds. You'll explore substitute ingredients so you can enjoy your favorite foods again. She'll even help you make food preparation easy and guide you on your path to healthy living. And to get started, all you have to do is call 604-445-6463. That's 604-445-6463.
HealthyLife.net, the positive radio network.
YumFoodForLiving.com is the place to get easy allergy-free recipes, all free of sugar, gluten, and dairy. But that's not all you'll get when you visit YumFoodForLiving.com. You'll get resources for all kinds of things like wellness articles, videos, podcasts, a blog, all to help you create easy, healthy living. There's even a 50-page downloadable book introducing you to the philosophy of Yum. Don't wait. Visit YumFoodForLiving.com. YumFoodForLiving.com. That's YumFoodForLiving.com.
HealthyLife.net, the positive radio network.
Welcome back to the Dr. Theresa NIcassio Show. Today we're talking with the founder of MiddlesexMD.com, and we're talking about the importance of intimacy and lifelong intimacy. And what we're going to address right now, what Barb and I were saying would be great to discuss, would be about foundational intimacy, emotional intimacy, and also the kinds of things that can get in the way and start to erode away the intimacy. So can you just share a little bit about your notion about what foundational intimacy is and why it's a core to sexual health?
Yes, I do spend time in talking with women about intimacy because I think it's an important concept. There's the physical sex, the functional sex, but that's sort of a small dot on women's radar. The big dot really is intimacy. And I'm not sure, again, people often take the time to think about how they're nurturing that part of a relationship. So I tell women intimacy is really how you act with each other kind of before and after sex. Mm-hmm. So you've got technical sex and functional sex, but really intimacy reflects the relationship really at the times outside of that. And I think women inherently completely get this. They completely know and understand this. But in talking about some of the components that make for great intimacy, I think sometimes it helps women understand why it might be absent. And I point out trust. And unfortunately, in a lot of relationships, there has been some trust that maybe has been compromised at some point. And that's where therapists can be very helpful to regain or rebuild trust if it's been eroded at all and at any time. But generally speaking, in order to be completely vulnerable, you need to have complete and utter trust in that person. And our instinct is to maybe not always be vulnerable and to protect ourselves or hide a little bit or just not want to be completely forthright in sharing. We're maybe a bit afraid of rejection, maybe rejection again. And so I think, it's helpful to be honest with yourself about where you stand with that. The other piece I mentioned to women about intimacy is respect. And again, there are a lot of pretty marginal relationships out there, and people are motivated to enter a relationship for a variety of reasons, but it's hard to have a really great intimate relationship if there is an absence of respect or there's been, again, eroding of respect. And I don't know how easily that's regained. I think it's either there or it's not there, and we all have a different idea of what respect might look like, but it is a critical path to having really a robust, intimate relationship. Along with that, then comes admiration, and that's, I think, most people are in love with the person they're sharing a sexual relationship with, but what about really admiring that person? And again, now we're talking about the not with sex, the before and the after sex, and what they provide to the relationship and how they encourage you and make you feel good about yourself and promote you and your general how you feel about yourself. Your partner plays a big role in how you feel about yourself, and I think that's some partners are really, really great at that, and others, never will build women up, so to speak. And then the last I tell women is acceptance, and that probably goes back a little bit to the vulnerability too. And women are their own worst enemies often, and we sometimes are not very accepting of ourselves. And along with what happens in menopause, oftentimes is weight gain and the physical changes that go along with that. And one of the 3 most common reasons for women to decide not to have sex is a negative body image. Mm-hmm. So talking to women about how that influences their sexuality, I think, again, not that you can always change it, but the awareness of that it is influencing your sexual relationship, I think, is at least a good beginning, and encouraging women in that journey of accepting themselves.
Mm-hmm. It's huge. So huge. And I'd say that actually resonates not even just for women in later years, but even in any age, that acceptance, body image, and going back to the media. I mean, the media has so many negative and judgmental expectations and messages around body and body shape, body size, that it makes it really difficult to you can say, "Oh, love yourself," but it can make it really difficult when there's so many messages that seem to reflect the opposite.
Yeah, and the other thing, and I don't know if you've come across this, but another thing that I have found very difficult in the last 5 years that maybe I wasn't hearing about 20 years ago is how pornography has eroded women and their view of themselves. So when their partners are viewing pornography and oftentimes as a result of that, finding their own partner less desirable or unable to perform with their partner because, over time, the images that are required for men to have the sexual experience typically it has to increase over time. And oftentimes their partner, their spouse, no longer provides what they need to be sexually aroused. And that's really devastating for women as well. And mm-hmm. I feel like it's a frustrating and somewhat overwhelming obstacle for some couples it saddens me that is the case, but I mm-hmm. think it's the culture we live in, and mm-hmm. we need to, again, have more awareness and discussion about it, because sometimes when it's utilized, I'm not sure people always understand the possible outcomes that might come from that.
Yeah, I've definitely seen it as well, and it's not even just in pornography, but just in day-to-day social media. I mean, Instagram images, and I've even had clients, talk about, and some partners say, I look at these other images, and and they find them quite arousing, and then they're finding, when your partner's less perky, their body parts aren't quite as perky. Yes. It's just part of life, as some of the images you see, and it does have a psychological impact. But one thing I just want to bounce off, I love what you're saying what happens before and after sex, and that is, I love to tell people that foreplay begins the moment you awaken. It doesn't stop until the moment you go to sleep, and it doesn't have to do anything with being sexual, but it has to do with all those factors that you're talking about, letting your partner know they matter, that you see them, being present for them, admiring them, being kind and loving and tender.
Yeah, I know, and I think in the busyness and just the day-to-day, plugging away and meeting all the needs of the people around you and work, it's easy for that to get lost. On the other hand, it might only take 30 seconds of your day to share that sweet sentiment to your partner, or
a wink. It can be a wink. It can take half a second. Yes,
exactly. And I think people lose sight of oftentimes the way something small like that can have a really big impact.
The simplicity, yeah. So we need to go to another break, but real quick, one of your great quotes I love is, "Nothing says love like taking out the garbage." So anyway, on that note, we're gonna be up next after the break, and we're gonna just do some wrapping up, talking a little bit more about the erosion of intimacy, which we've already been doing a little bit of, and then getting into solutions, more about solutions. So stick around. We'll be right back.
Being inspired by a speaker while learning everyday positive information that you can use to help your life is exactly what Dr. Theresa NIcassio does when she speaks in front of your group. From healthcare professionals to special needs parenting and everything in between, Dr. Theresa NIcassio can customize topics for your group on everything from health to psychology. To book Dr. Theresa NIcassio as a speaker for your group, visit yumfoodforliving.com or call 604-445-6463. That's 604-445-6463.
If you're like the 8 out of 10 women that say finding jeans that fit is a problem, well, your problem is solved. Lee Jeans has done extensive research, and they have jeans that fit. There's even an online Lee Fit Finder, so you can find the right fit for you. Imagine jeans that instantly slim you with a custom fit and no gap waistband. And guys, kids, Lee has jeans for you too. Click through to Lee's Jeans on the HealthyLife.net advertiser page and get what fits.
When you have a food allergy or dietary limitation, Dr. Theresa NIcassio knows it's hard to give up the foods you love, so she decided to put on her chef hat and give you affordable, personalized culinary consultations that will light up your taste buds. You'll explore substitute ingredients so you can enjoy your favorite foods again. She'll even help you make food preparation easy and guide you on your path to healthy living. And to get started, all you have to do is call 604-445-6463. That's 604-445-6463. There's a book that makes it so easy to embrace a healthy, gluten-free lifestyle, even kids will like it. Filled with heartwarming stories, food as medicine health tips, easy allergy-free recipes, and creative culinary inventions, the award-winning book Yum by Dr. Theresa NIcassio is your source for all of this and more. So make gluten-free living easy, tasty, and fun. Get Yum, plant-based recipes for a gluten-free diet at Amazon.com. Or visit yumfoodforliving.com. That's yumfoodforliving.com.
Radio your way. HealthyLife.net.
Welcome back. You're listening to the Dr. Theresa NIcassio Show, where we celebrate life, love, and kindness while also acknowledging the real challenges that are a natural part of living. And we're here answering questions that matter to you, even the challenges that may feel a little or a lot awkward or difficult to talk about. If you're just tuning in, we're here today with gynecologist, menopause specialist, and author Dr. Barb Depree about lifelong intimacy. And before the break, we were talking about emotional intimacy, Barb, and a little bit about the erosion of intimacy. I wonder if you could share a little bit more about what you've noticed about some of the factors or things that can happen in a relationship or for someone in their sexual relationships that start to peter things out a bit.
Yeah, I think the two areas that probably interfere that I see most often are going to be boredom and the routine, just the kind of the monotony of I know he's going to touch me here next, and then I know he's going to do that next, and meanwhile, you can be in your mind, putting the grocery list together or the return email that needs to be done.
Groceries to buy, yeah.
Yes, so I do think encouraging novelty and having people try to, again, recreate some playfulness and add more time and the whole idea of place and situation and time of day, and just if you can make it less routine, and small things can make a difference. So thinking about how you can incorporate some newness to the what's probably been present for many years. And then the other thing is what happens for women physiologically, the combination of a loss of desire and then the increased discomfort. And, of course, the natural tendency then is going to be to just avoid sex because, number one, I'm not that interested, and number two, it hurts when I do it. Mm-hmm. And obviously that's going to continually perpetuate just more discomfort. And we've talked about the desire discrepancy and where it can lead in relationships, and unfortunately it can be the demise when you look at friends who've been married for 30 or 35 years thinking, oh my goodness, how did that happen? I thought they were meant for each other for life. And you know what? I can tell you what probably happened there. Mm-hmm. I think it's important to remind individuals, again, sexual health, sexuality in a relationship is really a critical component to the health of that relationship. There is a statistic that when sex is good, it adds 15 to 20% additional value to a relationship, which is great. But when it's bad or non-existent, it plays an enormously powerful role in draining the relationship of positive value, a drag or negative value of up to 50 to 70%. And there have been some studies that have been able to try to quantify that. So obviously, yeah, the positive margin, great, but the negative margin, when it's not great, is really big. And we know sex actually has some health benefits. It does lead to a longer life. It protects against heart disease. It improves the immune system. It helps people with chronic pain. It burns calories, too. So there are lots of good reasons to stay in the game, so to speak.
Mm-hmm. Yes. So, it can be difficult, and so if you are having pain with intercourse, it's really important to see your healthcare professional and see if there's anything that can be done. Just stopping having sex may actually make things worse, as you talk about in the book, but there's also some beautiful and wonderful things you can do that can make it better, and also changes in how you are sexually engaging with your partner. You want to speak a little bit about that and how that what kinds of changes might make it less painful, less discomfort, and what sorts of things a doctor might suggest to help it along to be more pleasurable?
Well, I think the number one thing is to make sure you mention it to your healthcare provider. And not every healthcare provider may be comfortable in having that conversation or well-equipped to do a careful examination to try to help assess that. But there certainly are those providers out there. So if you're not comfortable in the relationship you have now, you need to find somebody you can have that conversation with, because so many of the conditions that occur are absolutely treatable. There's a number of vulvar conditions. There are pelvic floor muscle conditions. The most common condition is going to be vulvovaginal atrophy. We've renamed it genital urinary syndrome of menopause. Again, it's a direct result of the absence of estrogen, and there's literal thinning and drying and narrowing and shrinking of the genitals. And the way to prevent that is, number one, have sex, because during sex there's more blood supply to the genitals, which in turn helps promote the health of those tissues. But think about using a vaginal moisturizer. Vaginal moisturizer is a lot like a moisturizer you apply to the skin. You want to prevent it from drying, you'll use a moisturizer. Over-the-counter, non-prescription vaginal moisturizers are done not to restore the moisture, but to help prevent the loss of it. So early in menopause, it's helpful to begin that process to make sure you're going to maintain the moisture and the comfort. And then when it becomes a little bit uncomfortable, lubricants. Lubricants come as a variety. Water-based, hybrid, silicone, they have different characteristics. So my website, Middlesex MD, was really an effort to try to be a tutorial for women in helping understand what the products are and how you might go ahead and select it. I did a journal article, and I went to two of my local drugstores, and one had 38 vaginal products and the other had 14, so it can be a little overwhelming. Pelvic floor tone, an orgasm, after all, is contraction of pelvic floor muscles. So for women who keep great pelvic floor tone, that will continue to promote how they experience and enjoy sex. So pelvic floor exercise tools might be something that makes sex more enjoyable. If it takes longer to arouse an orgasm, introducing a vibrator can be very beneficial. And for many women, about half of women, they've never tried or used that. I use the analogy, when your vision goes, you don't stop reading. You get eyeglasses. So when this becomes more challenging, seek out some tools that might be helpful to restore sexual health.
Fantastic. And Barb has written a fantastic book called Yes You Can, Dr. Barb's Recipe for Lifelong Intimacy. Again, information and links for that and her website are on the TheresaNIcassio.com website. And you just mentioned about the pelvic floor exercises. As also we've had on the show twice. We've had Kim Vopny, who's a pelvic floor specialist, and she also has other kinds of exercises and tools. So another resource, and you might want to listen to her show, the one she's been on the show, which is great. But we are going to need to be coming to a close. The time just flies. But thank you again for joining us, Barb. This is really important information.
Thank you for having me, Theresa.
Great. And I hope all of you who are listening have enjoyed the show. Be sure to join us next week when inspirational speaker, TV host, and author Yvonne Heath is going to be with us talking about living life fully, beginning to the end, and the importance of showing up while doing so. Feel free to send me any questions you might have. My web address, again, is TheresaNIcassio.com, TheresaNIcassio. I'm Theresa, and this has been the Dr. Theresa NIcassio Show. Until next time, have a great week.